Thanks, Anna. All right, we're going to get moving. Good afternoon. My name is Beth Trzanski. I'm the Deputy Director of Building Bright Futures. Stepping in to facilitate today as Morgan is on vacation, as are a whole slew of folks. So glad you could join us. I'm excited for our time together and presentations. So we are coming together for the February meeting of Vermont Early Childhood State Advisory Council. And we are going to start with a few items of business. And then we have some opportunity to connect with folks in pairs. And then we have some really cool presentations looking back on the impact of some grants and looking forward to some additional projects that we are working on. So that's the plan for today. We can go to the next slide. Thank you. And then just before we move too far into our agenda, just want to give folks a heads up that this is February, so next month at the March State Advisory Council meeting, the executive committee is going to bring forward nominations for some new members. We have a few members who are finishing their second terms, and then some transitions on our executive committee. So hard to say goodbye to folks, but that will be coming next month. Also, another heads up, and we will send an updated calendar invite, but we are planning for an in-person May meeting. We're going to do that meeting is moved due to Memorial Day. So it's going to be on May 18th, which is a Monday in the morning from about 9:30 to 12. Right now it's tentatively in Waterbury at Zen Barn. And that meeting serves as our annual Vermont Early Childhood Strategic Plan Summit. So anyway, May 18th in the morning in person in Waterbury, and we'll get more details to you. So those are just some things to be thinking about into the future. And with that, I am going to hand it over to Floor, who's going to do roll call. And Tanya, we can pull down the screen share for this next section.
Good afternoon, everybody. Hope you can hear me okay. I'm wondering if we could get just the staff committee members to have their cameras on. We're trying to just count quickly to see if we have quorum. I think we do, but let me count, you guys. One. I think we do. So I'm going to go ahead and go through the whole thing. So good afternoon, everybody. I'm Claudia Smith. I am your private co-chair and I serve on behalf of Vermont School Boards Association. I'm going to do the roll call quickly. Janet, do you want to introduce yourself?
Hi, Janet McLaughlin, Deputy Commissioner within the Department for Children and Families that oversees the Child Development Division.
Thank you. Lauren Omland from the Department of Health.
Laurel Omland from the Department of Mental Health.
Yes.
Yep. Hi, thanks.
There you are. Erin Davis. I'm not sure if Erin is going to be able to join us today.
I see Pat here. Yeah, go ahead.
Sure. I'm here for Erin and Zoe.
Okay. Hi, Pat. It's so nice to see you.
Nice to see you too.
Pat, could you just introduce with your current title? That would be great. Thank you.
Sure. I'm Interim Director of Early Education here at the Agency of Education. So it's great to be here.
Thank you, Pat. Susanna Davis from the Office of Racial Equity. I know that she was not able to join us today. Renee Kelly, you want to introduce yourself? Head Start. Suzanne Coburn from AHS Secretary Office. Jessica Bittman from the Agency of Commerce and Community Development. Lindsay Barron, Representative Family Services at DCF. And Monica Hutt, representative from Governor's Office and non-voting member. Okay, our legislative representatives, and I see both of them. So Representative Ray Garofano, you want to introduce yourself?
She's here. She's saying, yeah.
Okay, Martine.
Hi, everybody. Senator Martine LaRocque-Ulick. I serve on Senate Health and Welfare and also on the Finance Committee. Nice to see everyone.
Good to see you, Martine. I'm going to move into our private and large members. Becca Webb, you want to introduce yourself?
Hey everybody, happy vacation for those of us who are on school vacation. I am the UPK Regional Coordinator for 10 school districts down Central Vermont.
Thank you, Becca. Christy Swenson.
Hi, I'm Christy Swenson. I'm a Head Start Director.
Thank you. Daniel Mitchell. Carol Long-Gauding.
Good afternoon, everyone. Carol Lang-Gunn. I'm the Executive Director at Memorial Family Center, and I'm here representing Parent Child Center Network.
Thank you, Carol. Laura Young. I see you, parent representative.
Hey everybody, sorry I'm super sick and so I'm getting my voice back little by little, but I may be participating via chat to try and preserve it, but I appreciate seeing you all.
Thank you for making the time, Laura, and take good care. Amber Henson. Amber, are you here?
Amber Houston,
Yes.
I'm also a parent representative and I have loud children in the background, so bear with me. Thank you.
That's exciting. That's why we're here. So, and a few members besides the ones that you have seen that were absent send their regrets. My co-chair, Lisa, from the Department of Health. She's also on vacation, school vacation. Kiona Heath, Dimitri Gardner, Edie Gale, Erica. Erica, you're here. I saw you. Erica McLaughlin.
Yes, here. Thank you.
Go. Do you want to?
Sure. Erica McLaughlin from the Vermont Principals Association.
Sharon Harrington, Vermont Association of Education and Young Children. She sent her regrets. And Dr. Deb Harswick, retired pediatrician, also sent her. So let's see, do we have 13? Is the big question. And Beth, 1, 2, 3,
Yeah,
4,
I
5,
think we're
6,
good.
7, 8, 12, 13, 14. Oh, we do. All right. So I'm going to ask, you guys had the minutes as part of your packet. I'm wondering if I could have a motion to approve the.
I move that we approve the November minutes.
I'll second.
I think my connection is getting unstable. Amber, is that second by Christy?
Yeah,
Oh,
I got it. Thank you.
Behind.
Yeah.
Oh, you got it. Yeah. Any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none. The minutes have
I'll abstain.
carried, and
I wasn't here, so.
Okay, we got it. Thank you, Christy.
Okay. We got you. 1 abstention for Christy. All right. And with that, I am going to give it to Anna and Beth back for our connection.
Okay, thank you. We're going to take a few minutes to let folks connect virtually, but as if we were imagining that we were in a room together. So just giving folks a chance to share. Oh, we have the wrong. And I'll put this in the chat. What are you holding on to bring energy and inspiration during this chaotic time for our country? So that's a prompt if you would like to follow that. And Anna set up some pairs. So if you get in a room with someone you don't know, introduce yourself. And we're going to give you about 10, 15 minutes to be able to introduce yourself and connect with each other. Any questions on that? All right. Well, why don't we move into pairs and we'll come back in 15. Welcome back. Thank you for taking some time to connect with others. It's really, really nice. Recognizing that it is really important for us to be able to connect with each other, especially when there's so much in motion and some things that we have control over and some things that we don't. So just really nice to be able to be here. Thanks for the notes in the chat. All right, so we are going to move into talking about some things that are in motion in our state. So we're going to start with Michelle Kersey, who's been our grants manager for the Vermont Early Childhood Fund. She's going to talk about the impact on communities through the work that fund has done over the last 3 years. And then we're going to move over to Janet McLaughlin for some others moving forward. So Michelle, you're up, and Tanya, you would bring the screen share back up.
Hi, everybody. I am so excited to be presenting today on the Vermont Early Childhood Fund and what we as a state have been able to accomplish over the last few years using funds through the preschool development grant. So the preschool development grant, as some of you maybe remember, had a component for distributing funding into communities to strengthen the early childhood system. And so between February of 2024 and January of 2026, we were able to distribute just shy of $8 million to 107 organizations located throughout the state. It's interesting to note that almost half of the grantees spent less than $50,000. So there are a number of organizations that were able to get a lot done with just a small investment of federal dollars. For as many grants as we were able to make, there were still a significant amount of requests that went unmet. In the final round, there were 57 applications that requested about $3.3 million that went unfunded. So as much as we were able to put out the door, the need is still there. There are still organizations that are looking for funding to increase access to programs, to help develop the workforce, and to do other work that's really essential in the early childhood system. So funding, there were 4 funding categories that we looked at when we were evaluating applications. We were looking for organizations that made proposals that would either increase access or provide more equitable access to services and programs, would work on developing the workforce, would improve the quality of existing services and programs, or would engage families and help connect them to services. And the breakdown of the projects that we actually did fund were pretty evenly distributed, although you will notice that the largest portion went to funding programs that focused on increasing access and providing more equitable access. About 36% of programs did that. And then a smaller percentage, about 16%, were focused on engaging families and connecting them to services. And it's also important to note that a number of the programs were able to accomplish multiple different areas of work. So while they were increasing access, they were also improving their program quality, or they were developing the workforce while they were improving program access or improving the quality of their programs. So I wanted to start by just showing you how the funds were distributed in terms of geography. And I wanted to point out one of the successes of this funding was that we couldn't fit all of the funded projects onto one slide. There are just too many programs that were funded. So it's a really great visual representation of how much funding was able to go out and impact communities. So next slide. So this slide focuses on the fundings that went to projects that were acting in a statewide capacity, as well as projects that were funded in Chittenden County. So there are 6 statewide projects. They included supporting pediatric and perinatal medical providers through a free training for therapists in the SPACE therapeutic model, which is an evidence-based treatment for anxiety, OCD, and related conditions, for those of you not familiar with SPACE. There's also work by the Vermont Parent-Child Center Network to boost family engagement and leadership at parent-child centers throughout the state. For those of you who are not familiar with Vermont Connector's Baby Product Exchange, this program distributes donated baby and toddler supplies to Vermont families through a referral-based system, community swap events, and mutual aid networks. And so funding helped them make the transition from a volunteer-led organization to an organization that was really able to focus on building good systems, hiring a few employees, and scaling things up in terms of their reach. And then there was also a number of projects that focused on professional development for early childhood educators, including a project by Prevent Child Abuse Vermont to offer free training and materials to early childhood centers and elementary schools using the Care for Kids program, which is a prevention tool that helps to decrease the incidence of child sexual abuse. Next slide, please. And then, actually, can you go back a slide? Sorry, and some points here. As the most highly populated county in Vermont, Chittenden County had the largest number of projects with 25 organizations that were funded, and they utilized about 25% of the $8 million in funding. 12 projects in Chittenden County were focused on early childhood care and education and helped expand access by adding slots or increasing enrollment, improving program quality, or developing the workforce through training and or professional development. 3 projects in Chittenden County focused on expanding access to a variety of therapy services for young children and their families, and that included play therapy, speech and language therapy, and parental supports for children with behavioral, emotional, or mental health conditions. 3 of the projects provided support for prenatal and post-birth parents and caregivers, including expanding doula workforce and providing support for families of children in the neonatal intensive care unit. 5 projects focused on providing community-based child and family programming, including connecting parents to services. I especially want to call out the work that Janet Esmont Family Room did. They hired a bilingual program facilitator who worked specifically with non-English speaking families to help them with things like completing paperwork to be able to access support and meeting with families and helping them to navigate some of the complicated systems like accessing childcare, accessing housing, and working with schools. And then 3 projects focused on expanding and improving access to food security in early childhood. Okay, now I'm ready for the next slide. So outside of Chittenden County, Lamoille County received the least amount of funding of all of the counties in the state. And this was due in part to the fact that one of the grantees that received an award, or one of the organizations that received an award, chose not to accept their award. And it had to do with some of the requirements in the grant agreement. Washington County received the second highest number of funded organizations, with 12 organizations utilizing a little over $750,000. And I also want to point out that the dollar amounts on these maps are the funds that were actually utilized. They weren't the amounts of the grant awards. We found in a number of cases that grantees weren't able to fully spend the amount of their award, either due to challenges within the project, or our last cohort of grantees had 6 months to utilize funds, and not all of them were able to do that in such a short time frame. As we look at the northern half of the state, there were quite a few projects that focused on early childhood care and education, including adding spots, improving program quality, and providing professional development to early childhood workers. Some of the projects that focused on other priorities included Northwestern Medical Center's expansion of developmental assessments and access to supports for children with developmental differences. Washington County Mental Health Services provided free training for people interested in becoming a doula. They also recorded a lot of their training sessions so that they would have them for ongoing training of people who are interested in becoming doulas. And they, and they established a doula advisory board for the state. Green Mountain United Way brought the Working Bridges program to staff and parents at a child care center in Waitsfield. And that was a new focus for the Working Bridges program. They've worked with a lot of employers throughout the state, and more recently have started to focus on bringing these programs to childcare centers. And then Seed and Sow, which offered free certification to programs in the Northeast Kingdom. They found success by onboarding 27 centers and 24 family child care home providers during that grant period. And those providers and teachers utilized more than 1,000 hours of professional development across 770 workshops. So great way to get professional development out to early childhood educators, especially those who are pinched for time, since it was they were able to take the courses when it worked for them, based on some recordings. We also awarded some additional funding to Seed and Sow that is allowing them to complete a research partnership with MDRC, and they were able to complete the first phase of that research partnership with a third-party reviewer to prove the promise of Seed and Sow. Slide 7, please. In the southern half of the state, there was a similar focus on early childhood care and education for a lot of the grantees. Some of the projects that focused on other priorities included 2 rural libraries that improved their offerings for young children by accessing additional space, purchasing books and toy lending libraries for the community members who have young children. Also, the UVM Migrant Health Program was able to hire a bilingual community health worker in Addison County. During the grant period, the community health worker received formal referrals for 41 children and pregnant women, identified 741 unique unmet health, social, and educational needs for her clients, and she was able to meet the desired outcome in 97% of the cases by working together with families, volunteers, and service providers. One of the disappointing pieces that we found with some of the grantees, including the UVM Migrant Health Program, is that they had to discontinue the program. So UVM decided to discontinue this program as of June of 2026, in part due to lack of funding. And I also wanted to highlight Junebug in this group. one of the interesting things about the grants is that we made grant awards that range from $10,000 to over $400,000 to organizations. And Junebug, which provides winterwear for children from families with low incomes, use an award of $10,663 to secure climate-controlled storage, improve their storage and tracking systems, meet with partners to assess how to improve their systems so that they could increase utilization rates, and met with COTS to discuss establishing a similar system there. Slide 8, please. So looking at the program at a high level, there were some challenges, and none of these were real surprises to us. The first is related to external factors, which we all know about. Hiring and staff retention is really an issue for that was reported by all of our grantees, or not all of them, but 71% of our grantees. They saw issues hiring qualified staff to start with, and then high staff turnover rates. And it's important to note, too, that this is not exclusive to early childhood education programs. Grantees who were healthcare organizations, nonprofits and communities, and public schools also experience workforce challenges. And I pulled a couple of quotes. In particular, there was one early childhood program that started in Randolph that had a full staff turnover during the time period of this grant. So they started their program in November of 2024, and by the time the grant had ended, had a completely new staff, which is really difficult and was a real struggle for them, and something that I heard from a number of organizations. I also saw turnover at the director level in quite a few programs, both nonprofit programs and early childhood programs, that affected grantees' ability to implement the projects that they had submitted and to spend the grant funds that they had been awarded. The next two challenges were pretty specifically related to constraints associated with the federal funding. The first was reimbursement-based funding. We knew that this would be an issue. We know that it prevented some potential applicants from submitting proposals. And even for those grantees who received awards, while BBF was as responsive as we could be and provided a 1-month turnaround time between receiving an invoice and providing ACH payment to reimburse for that invoice, smaller organizations still struggled with it. In some cases, if they made purchases at the start of a month and then submitted the invoice for that purchase at the end of the month and then got reimbursed at the end of the next month, they were carrying the costs of that grant for up to 2 months. And so again, for startups, for small businesses, that was really an issue. And then one of the other issues was the fact that the grant did not allow for construction, renovations, or capital purchases. And while we tried to make it very clear to applicants that construction and renovations would not be funded through this grant, we still had 16 organizations that applied for construction and renovations and had to decline those applications right after they were submitted. For the projects that were doing construction or renovations that were funded outside of this grant program, there were all kinds of construction delays, and quite a few projects saw or experienced the need to decrease the number of slots that they had originally proposed in the grant application because project costs just skyrocketed over the last 3 years. And they often needed to value engineer out some things that affected their overall capacity in the long run. Interestingly enough, some of the small family childcare homes that started up during this grant funded period, we would fund the startup process and they would indicate that they were going to open 6 or 8 slots, and then came back at the end of the grant period and said, well, we actually ended up opening another room and adding an additional 10 slots. So it was really an interesting learning experience for me to see big projects that proposed providing 60, 70 slots have to cut back to about 40 slots, and then small projects that were proposing to offer, 6 to 8 slots, turning around and offering 20 slots. So I think that was a really interesting piece of information. Next slide, please. So I'm really happy to be ending by sharing all of the incredible things that were accomplished with these grants. One of the easiest things to quantify with the grant funding was the ability to increase access to early childhood education programs through 3 new family child care homes and 5 new center locations, 380 new licensed spots in 17 programs, an additional 134 new licensed spots that are expected over the course of the next year, 46 additional children served through increased enrollment, whether it was due to being able to open a classroom that had been closed during COVID by hiring new staff, or other ways of coming up to full enrollment. Additional infants being cared for by adding staff and shifting some of their slots from toddler slots to infant slots. And also the preservation of 10 slots down in Dummerston from a program that lost its lease and ended up moving into becoming a family child care home. 72% of responding grantees reported that they had more trusting, organic, and deeper relationships with families. 69% of responding grantees reported positive gains in social emotional learning and regulation. And 43% of responding grantees reported a better ability to serve marginalized families through offering better language access, cultural affirmation, increased support, and stigma reduction. And so I'd like to stop to finish by recognizing collaboration partnerships that were necessary to make the VECF grants possible. While Building Bright Futures served as the lead in this activity, this took the cooperation and collaboration of all kinds of organizations to make this work happen. First of all, I want to recognize the grantees. These grants included some challenging federal compliance requirements, and all of the grantees across the board, they were patient, they were persistent with submitting information and some of the back and forth conversations that we needed to have around needed documentation. Also want to give a shout out to the business office at the Vermont Department of Health, including Kim Bean, Lauren Eicher, and Lola Chu. They were great to work with. They made sure that BBF had sufficient funds in our bank account so that we could quickly reimburse our grantees. And at some points, I think the final month of the grant, we put just shy of $2 million out the door. And so working with them to make sure we had the funding in our account so that we could do that was really key. There were 50 different people who participated in reviewing grant applications along with BBF staff. We had nonprofit partners, state agency partners from the Child Development Division, the Vermont Department of Health, and the Office of Racial Equity. And all of these people came together, evaluated applications, and helped us select projects that best met the goals of the preschool development grant. I want to also give a special shout out to Beth Moore from the Child Care Licensing Department, who reviewed the list of early childhood education programs to make sure that they were in good standing, and to our partners at First Children's Finance, especially Erin and Kathy. While we were managing the VECF grants, they were managing the Make Way for Kids grants. And so we worked together to communicate which projects were getting funded, what they were getting funded for, so that we could make sure that both pots of money could go the furthest. And so there wasn't any duplication in funding. And of course, the entire team at BBF, this was a full staff kind of process where everybody was involved in the grant decision processes, and especially Katie and Nate, who made sure the grantees received their reimbursements. If you have any questions about specific grantees or about other impacts that I might not have mentioned here, I'd love to hear from you. Feel free to email me. I will throw my email address in the chat, and I'm happy to talk more.
Thank you, Michelle. That was such a great presentation. It's good to see everybody. I'm Anna Brulette, the Policy and Program Director at Building Bright Futures. And we have some time for questions. I see a question and a couple of great kind of just comments in the chat, Michelle, about the impacts that folks have personally seen related to these projects, which is really cool. There was one question from John that I think perhaps you could help answer, but I think Janet's presentation in a bit is also probably going to partially address, which is, might any other grants become available which would be geared towards supporting construction, renovation, and capital expenditures? So, Michelle, I don't know if you have anything to add about that or if we just want to wait.
Yeah, I mean, I definitely, Dan is going to cover that, but also the Vermont Community Loan Fund has the early childhood, I forget the name of their loan project, but specifically tailored to early childhood programs for construction, renovation, purchase of a child care program. And that's a great place to start because usually construction and renovations take a lot of investment, and you may have to go to multiple sources. Depending on whether it's new construction, I saw a number of grantees use the Vermont Rural Development Grants, and some other like bigger state grants were available through the Agency of Commerce and Community Development. So those are definitely places to start too. And then as far as renovations go, I know the Make Way for Kids grants, they are tied directly to creating new childcare spaces that receive childcare financial assistance. But some of those funds could be used for renovations. And if Erin or Kathy are on the call, they might be able to weigh in on that as well.
Great. Thanks, Michelle. I see both Erin and Kathy. Welcome any other comments or context you all have, but I don't want to put either of you on the spot. Feel free to chime in.
I'll put the link to the guidelines for round 3 in the chat. Yes, minor renovations are allowed. So, and I think Janet will have some more information that'll be useful.
Thank you, Kathy. All right, any other questions for Michelle or the BBF team about Vermont Early Childhood Fund grants and all the great investments that were made and projects that were completed? And thank you, folks in the chat.
Just to add that it is worth stating again that we had to pretty much move mountains to be able to use federal money to be able to get to fund eligible projects, right? Like this was a federal grant. They did allow granting money out to communities, but the eligibility was not easy. And so we had to be super creative with what could be funded. And as Michelle talked about a couple of times, like really be planful so that people were out money as short a time as possible, because we know that that's not easy. So just really calling out that it was an amazing opportunity, because not all preschool development grants allow for community-based subgranting, and the fact that this one did, and that it ran its course, that we were able to run the grant all the way through. We do have a small no-cost extension, but pretty much we thought a year ago that grant might get cut off, given what was happening in the federal government. And so the fact that it was able to run its course, knock on wood, and that we were able to grant all of the money out was really important. So thanks to Michelle and the team for figuring it out, and for everyone to kind of bear with us. We know it was not the easiest of proposals.
Lots of applause and gratitude in the chat and here on the screen for Michelle and the team. We have a couple more minutes. Does anyone have any final questions before we transition to our other presentation? Okay, well, feel free to add them to the chat if they come up, and we'll do our best to answer them, either in the meeting or afterwards. And with that, I'm gonna hand it over to Janet. And I think, Janet, you're gonna share your screen to walk us through these two grants that Vermont has been awarded, which is really exciting.
Yep. Thanks, Anna. And thanks for that presentation, Michelle. It is really exciting to see everything that was able to be accomplished through the Vermont Early Childhood Fund as one component of the 23 to 25 preschool development grant, Birth to Five. I feel like one of the things that I really appreciated about it was, and you kind of heard it in Michelle's thank you, was really all of the collaboration that really went into it to try to make sure that the projects, to try to make connections between projects as they needed them, to, if somebody was applying for something, but you knew somebody, there was a state level resource that was maybe similar, making those connections. So I really appreciated all of sort of using, this specific pool of money, which was, was designed to, get some work done on the ground in communities to also sort of build some of that connective tissue that hopefully will allow, and allow a lot of the work to carry forward and the benefits of the grants to carry forward. So appreciating that. And I am here to talk to you about two additional grants that Vermont has now from the federal, with federal funding streams, which, as they were mentioning, right, have their own strings, but it's a lot of money, which is really exciting. So I'm going to share my screen quickly. It'll take me just a second to get organized here. Beginning. Okay. You guys are just seeing the right slide. Is that right? Not my notes. Okay, perfect. Thank you. Okay. So, Vermont was really pleased to have been awarded a 2026 preschool development grant, Birth to Five systems building grant. That is the official name of it. The federal government included grant twice in the name of it. And we, that many of you guys have heard, that the application was released on the Tuesday, I guess 2 Tuesdays before the Tuesday of the week before Thanksgiving, with an application of the day right after Thanksgiving, right, the Monday right after the Thanksgiving holiday. So our team, which included folks from Department for Children and Families, Building Bright Futures, as well as, I have the list on the other slide, so as well a list of a lot of our PDG partners really worked quickly to get this proposal done. And so we did it within 6 business days to make sure we could get it in and have enough time in case there were any snafus. The grant itself outlined these 4 key goals that are here, which I think really align with what all of our hopes and dreams are for for Vermont's early childhood system. I will offer this grant really focused much more on early care and education system than previous preschool development grant applications have. Whereas before they might have been a little bit broader early childhood, as you could tell from some of the examples that Michelle was sharing. The federal government, did narrow this focus to really focusing on developing a coherent, unified early care and education system. Wanted us to focus on creating seamless early learning experiences for young children. This grant is really focused on systems building. Again, how are we efficiently layering federal, state, local, and also non-government resources to meet the needs of young children and their families in our state. And the 4th goal was around giving working families more early care and education opportunities that meet their needs. So again, these are the goals that were set out in the NOFA is what it's called, the Notice of Funding Availability. But when we saw that, we were felt like it really aligned with where we're trying to go as a state. And we felt like we were really ready to move forward with our application, even on a short notice. We knew what did we want to do that this funding stream was going to allow us to move forward. It does not include funds, though, for some of that community-based grant making that the previous version did. And again, that's a choice that was made through at the in the federal level when they were writing the NOFA. It's not a choice that we made as a state. So where are we? So again, the preschool development grant, Birth to 5, 2026 award. This is a 1-year initiative, no extensions, is what the federal government, what we've been hearing from our partners at the federal government so far. And we were awarded $12.7 million. It is the most amount we've ever been awarded for any 1 year for a preschool development grant. We got some great feedback on our application, that it was a really strong application. And that, not every state did get funded. So I think there was some competition there, and it was really, I think it's a sort of a testament to all the work that we do together, that Vermont was really ready to apply in those circumstances, and able to put together a competitive application. Again, it's a really collaborative effort. Again, the DCF Child Development Division, we are the awardee. But our core partners, right, are Building Bright Futures, Agency of Education, the Department of Mental Health, the Department of Health's Family and Child Health Division, and Head Start in the state of Vermont, both the Vermont Head Start Collaboration Office, which is housed within CDD, and the Vermont Head Start Association, which is the association of the Head Start grantees throughout the state. And the entire project is really rooted in the Early Childhood Strategic Plan. So everything, all of the work that went into that, through the committees, through the feedback sessions, through the outreach, and then through the development and the refinement of that plan, really set us up well for to earn this grant award. The in terms of the major elements of this grant, so there's a couple of big things to know. So one is, again, this is really supporting multiple strategies to sort of strengthen and align our early care and education system, with that North Star being, right, we want it to be simpler for families to use. We want it to be easier for the programs and providers to operate, right? We want it to be better for children, right? We want it to meet their needs more fully. And we also want to be more efficient and more accountable. We know that even with, we know that there's room for improvement there for all of us. There always is. And some of that is about making sure our systems are designed to support us in doing that efficiently. And then for each award, the way that it was written, it was really defined around 3 critical elements. The first was around the statewide needs assessment and strategic plan. And again, Vermont really knocked it out of the park. Looks like we got full points on everything related to the needs assessment and strategic plan. And then some of the work that will happen within 2026 is really around making sure that the needs assessment stays up to date, using the sort of the meta-analysis protocol that already exists, and that the strategic plan is operationalized through the committee structure, through this advisory council, and that work, it's the work that we had been planning to do, that we envisioned doing associated with the strategic plan, but we're a little nervous because we weren't sure how that was going to be resourced coming into 2026. And we're very relieved that it can be resourced much more closely aligned with, with our vision and with our aspirations for children and families in the state. The second element was around outcome strategies to advance the program priorities. And some of these words, they're a little you could parse them out of is this a strategy? Is this a priority? Is this a critical element? It was a little bit of a confusing NOFA. So if there's times when I think you'll get the big picture, but we don't have to the exact words. Sometimes we're a little confusing. And So then there's the outcome strategies, and then I've got spend more time on that in the next slides. And so you'll see what those are. And then tracking project impact is the final element of it, is making sure that there is, again, a strong data tracking and accountability framework associated with this grant in particular, but also really just with our early care and education system overall, right? Do we have defined metrics that we've agreed upon that we're tracking over time? When we set out to do a project, right? Do we start it? Do we keep going? Do we complete it? Do we persevere? Do we get it done? And so again, the elements 1 and 3 here, that's really Building Bright Futures, who is our key partner in getting that work done as a state. And if we did not have Building Bright Futures, we would definitely not have been as competitive in getting this grant as we were, and again, in being able to meet our shared vision for young children and their families in the state. So I wanted to also let you know that we have established a preschool development grant Birth to 5 webpage on the CDD website. And you can see I've got the exact URL down at the bottom here for you. I just wanted you guys to make sure, so if you don't feel like you have to take detailed notes, because there's a webpage that explains the project overall, and then it does have as you scroll down to the page, you'll see some links to a very specific overview, and then also a link to the entire application. I can't remember how many pages it was. It was long, but I don't know, 50 pages, 70 pages. I can't quite remember which was, but it was long, but it's all there. So again, if you're interested in a particular project, you would be able to look at how what we said that what our intentions are, what information we pulled from the needs assessment to express why this was important to Vermont, what elements of the strategic plan it connects to, and then what is the specific work that we're planning on taking on with this funding. Again, we had to write this really quickly. We also were writing it for the federal reviewers, right, as the readers, not necessarily for Vermonters as the readers. So it is wonky, it is technical when you're actually at the actual application, but some of you will say that is still the level of detail you would like, and you can dive in. So I wanted to make sure you know that is there, so you don't have to feverishly take notes on the next sections. Okay, category 1. Again, this is the part where the names give of critical category 1 of critical element 2 within program priority, but right. Anyway, reconciling fragmented elements into a unified system, right? This is something that many of us feel really deeply, whether or not that we are working, at the family level or working at the statewide level, that we can feel that fragmentation much more than we would like to. And so this is really giving us some of the resources that we've been hoping for to be able to focus on alignment and unification across these systems. So the first one is around universal pre-kindergarten systems alignment and enhancement. And we already have a request for applications out in the world. I think they're due to Wednesday. But looking for some external experts to really help us think through sort of the Vermont's universal pre-kindergarten system as a whole. We want to really build from the strengths of what's working, since we know we have the second highest access rates for pre-kindergarten for both 3 and 4-year-olds. We know that we are seeing strong results on the developmental assessments and the Ready for Kindergarten scores. But we also know that there are places that not all children have access. And we also know that there's places where we can simplify and streamline. And so we're really going to focus on that with this work. So universal pre-kindergarten is one big piece, one big project and an area of focus. A second is around sort of a statewide collaborative framework for screening and referral and intake. And this is again for children for young children and their parents who are sort of starting the process of trying to figure out, where can we go to get help, no matter what their need. And their need could be that they need, it could be a food assistance need, but it could also be, again, that they're worried about their child's healthy development. And, maybe their pediatric, they don't have an appointment with their pediatrician for a while, but they feel like they need to figure out what they can do to support their child. And so, right now we have a number of different, entryways in for families, whether or not that is parent-child centers, children's integrated services, Help Me Grow, pediatrician, like all sorts of ways, again, right, that families are sort of, that either children are being identified or families are raising their hands to identify their own children. And, but we don't necessarily have that articulated as like a collaborative framework right now, and want to be able to get to that place. And again, the family child health team is going to be leading that effort. They're going to be using an existing contract that they have with Mathematica and are getting started on the work that would take that for us to make sure sort of that there's like a shared understanding of the system, that we're all moving towards the same vision together. The next one is around coordinated mental health and behavioral support models for early care and education. The Department of Mental Health will be leading this effort. And again, trying to, looking at there's a lot of different options, different things we've tried in this state, again, with some of them, many of them very successful, but not necessarily haven't had a place where they can sort of like come together, learn from each other, be like hung together onto one specific framework, and then identify sort of what is a model that we should be, the model that we want to be heading for, building in our state. Again, because this is a 1-year grant, right? We can't do all of that work of assessment and planning and implementation all in 1 year, but we're just going to take this sort of 1-year opportunity that we have with some funding to do some of this really important planning work that often goes goes sort of unresourced and sort of remains aspirational. And we're hoping we can actually really do it this time. And then the final piece within this category is around aligned professional pathways for early care and education. And this is an area where CDD and AOE are partnering to align some of our efforts related to workforce development, including efforts related to teacher licensure, related to apprenticeship programs. Also includes some work with Vermont AUIC as really a CDD's core workforce development partner. And again, building from so much great work that's been done over the years to build these workforce pathways, but to sort of dive into some of the places where we haven't, that some of these places where we might have been like dual tracking in the past, trying to figure out like how are we actually bringing this together into a really, again, to like a consistent framework. So that is that's category 1. Let's see. Are there questions at this point that I should be answering? I'm realizing in the Zoom, it has taken away my ability to see the chat.
There are not any questions in the chat at this point.
Great. Sorry, in sharing my slides on Zoom with 2 screens, I seem to have, I can see faces, but I cannot see the chat right this second. Okay. Category 2. Okay, this is around expanding program availability, quality, and viability. And again, multiple projects in here as well. As we were writing, we were really focused on those places where it was absolutely essential, right, for us to sort of continue some of the good work that's already been implemented with the preschool development grant, or that was getting, maybe things that we started with ARPA funds that now we want to make sure we're continuing. But also, again, this place to say, what's our dream list of projects, our bucket list of projects that we haven't had the resources to do, that this gives us some funding to do. So the first is, again, to build capacity to serve all children. And this is a bucket of funding that can be used for capacity building grants, for special accommodation grants, and for transportation funding. So that's money to continue that really important good work to make sure that children can access care and more children can access it. The capacity building grants, our partner there is First Children's Finance that administered the Make Way for Kids grants as well. So that's making sure we've got the funding stream for that work. The second is around strengthening childcare financial assistance outreach and eligibility determination work. We want to improve the communications materials that we have associated with childcare financial assistance and some of the explainers and the backup materials. And we've got plans for some focus groups with Child Trends as our partner. And we've already gotten some other, we get feedback, right, on what is, and we seek out feedback on what is it that makes sense to folks, what is confusing to folks about childcare financial assistance. And again, this will allow us to continue doing that research, but then also apply it and improve some of our, and enhance some of the materials that we have available. Also going to be looking at childcare financial assistance eligibility determination, looking at what are the strengths of the current system and what we can do to build from there. The application really did focus again on consistency and accountability. And in Vermont, the STARS system is really one of our core tools there. And we are really pleased to, that the STAR system now includes the class assessments, which look at adult-child interactions throughout, with an external assessor directly in programs. But we also are excited that we've got that we're going to have additional ways to analyze and resources to be able to sort of analyze and share that data to support programs in improving their quality, to support CDD partners and CDD itself in thinking through what we're doing that provides the right support to the system overall and to programs and educators overall. And then also working to develop and share parent education materials related to quality early care and education and the STARS system and regulated childcare in Vermont. The fourth bullet here, I think I've talked about it in this group before. We know that it is really important this is funding that will help us modernize our criminal background check system that we have here in the state of Vermont. This is something that I feel like it's one of these tricky things sort of within a broad state system where the Department of Public Safety has been, is the entity that can get that in the state that can get the FBI checks that are required by the federal government. But just sort of the way that the process and the budgeting and the communication works, it hasn't, while folks on the early care and education side really feel the challenge associated with the extended timelines we currently have, that hasn't translated into more resources for the Department of Public Safety to actually improve its technology and be able to meet its mission. And so with this, we did include $1 million to support the Department of Public Safety to be able to upgrade its system. We had already started working on this really last June. We pulled together a multi-agency work group to really focus on what is it. We've, recognizing that, the extended timeline is just, we have to address this challenge. So again, we were ready by the time this application came out in November. We were ready to put it in there in such a way that we said, yeah, we think we can actually spend that money in the 1 year. So we have with the team, again, Agency of Digital Services, right, is the state entity that supports on all technology related projects. And they have got a dedicated team working with DCF and with DPS on this, and are working and, have, secretary level buy-in, the heads of multiple agencies within the state saying this is a top priority. And we want to expedite this as much as possible. And everybody knows that this funding also has an expiration date on it. So really excited about that work. And then the final one here is around supporting health and safety in early care and education programs via training, consultation, and supplies. This is something that, again, the Vermont Department of Health, the Family and Child Health Division has been work that they've been supporting leading in the last several years to make sure that programs have good information and that they have access to some of the tools that they need to be able to ensure the health and safety of kids in their care. And again, this project will allow some of that work to continue. And I think also it'll really allow us to help build a collaborative framework for that work so that any future funding can really be maximized and leveraged even more efficiently. So that's category 2. There's one more category. That's it on this grant. Okay, so then this category 3 is using shared data to guide and improve the system, and this is some funding to support the CDDIS. This is our Child Care Development System Information System for to build the next phase of it for childcare licensing and workforce, hopefully in the very final stages of choosing our vendor and getting that kicked off this spring. We'll also be working on enhancing the CIS, Children's Integrated Services billing system from what it is right now. Definitely something that I think will, improve efficiency for both our partners and for the state. And then for BBF, looking at the, continuing the work of the Early Childhood Data and Policy Center, but really focusing also on making sure that Head Start data is integrated into that portal. That is my slides on the preschool development grant Birth to 5. I also have news to share about some disaster supplemental relief. People want questions on PDG Birth to 5, or do you want me to just roll through this one? I think I only have a couple slides on this one.
I think I would probably continue, Janet, given the time. And I don't see any questions yet. Yeah, thanks.
Yeah, great. Okay. Another exciting update. So through in December of 2020, where it would have been 2023, the Congress passed the American Relief Act, and that included some disaster supplemental relief funding for childcare. And that then the Federal Office of Child Care made those invited applications from each of the states and territories that receive Child Care Development Fund money. Is only available that those states that receive CCDF money and that had a federally declared major disaster or emergencies in 2023 or 2024. Vermont met that definition. And because we had multiple federally declared disasters and emergencies in 23 and 24 due to flooding, the funds are intended to support Vermont communities to recover from these disasters and emergencies. So this money is really about recovery. It's not about it's not necessarily about prevention, right? Or flood, mitigation for future emergencies. Like that would be a nice side benefit, but the purpose is really to support communities to recover as well. So it doesn't have to be that this exact childcare program was impacted. It can be that this community was impacted, and childcare is one of the strategies that this community is using to help them themselves recover from the impacts of the flood. So again, CDD worked with the Office of Disaster Relief to submit a letter demonstrating the need in Vermont for this kind of money and what we would do with it. there was a pool of about $250 million nationally. We asked for $30 million, which is kind of a lot of money for little old Vermont. But we decided to, go big or go home. And we are very excited that we were awarded $19 million. And we just got the news maybe a couple weeks ago. And this one is not quite the sprint that the preschool development grant is. This one, the funds must be liquidated by the end of the federal fiscal year in 2030. So we have 3.5 years or so to spend this money. So it's a little longer. Still a lot to do to make sure that those funds are spent in that period of time. And lots of lessons learned from, again, that recent preschool development grant as well around what movie strategies. Some of the approved activities are to support recovery and childcare supply building. This can include funds for construction and major renovation. So that is going to be allowed. That requires a lot more paperwork. Like everybody knows, like federal money for construction, major renovation it just has like a higher bar for receiving it and requires a significant amount of paperwork. On the CDD side, we have not historically given out construction, major renovation. So we anticipate needing to partner with the Office of Disaster Relief or ACCD to get that money out the door. We're still very much developing a plan there. It can also be used for materials, supplies, furnishings, equipment, minor renovations. So that would be some funds that would probably be used to plus up the amount of money given away through Make Way for Kids. And then there is a final category where we'd be able to reimburse for uncovered expenses directly related to this 23-24 disasters. So again, the final plan here is very much, this is really fresh. We had no idea if we were actually going to get the money. The federal government has said that they're going to have an information call for us soon on this. So I don't have, and we know that we asked for 30, we got 20. So we're still going to have to figure out, right, how we're aligning the initial budget with what we actually got. But it's pretty exciting to be able to know that we've got a significant chunk of funds available for, for supply building and including major construction for early care and education in the state. So that's it.
Thank you so much, Janet, and just shout out to your team for getting those grants for Vermont. It's huge progress and really, really good news during a time when we all need good news.
Special shout out to Helen Mattice, who's on the call, as well as Ray Garofano, because they were really the authors of our application.
Yay. Kudos to Ray and Helen. Any questions? We have just a couple of minutes left, and I'm sure Janet's team would be happy to answer questions either now or offline if we run out of time.
I will offer quickly that a number of these different projects will have feedback, have a steering committee, have places where we're gathering feedback, places where we're whether or not it's like a survey or focus groups and things like that. So that's very much a part of the process. At the same time, we also know we gathered a lot of that information in the needs assessment, right? It informed what was in the strategic plan. So in those places where we can just go back to, research that was done 9 months ago, we don't want to, we don't want to, reinvent the wheel. We don't necessarily in those cases. And we would use that, hopefully verify that with the group that still seems accurate and use that to keep us moving forward.
Michelle, go ahead.
I've got a question for you, Janet. I'm super excited about that second pot of money. And I'm assuming that it is going specifically to communities that were included in the federal disaster declarations for 23 and 24. When you think about how to utilize those funds, will there be conversations about pairing it with other state-funded projects that might be able to add childcare in? For example, an affordable housing development that might include plans for adding a childcare at the ground level in addition to housing?
So, okay, so I will say, so yes, because I think, again, we'll have ACCD, Agency of Commerce and Community Development, there as a partner with us. Definitely some of the, I mean, and Helen and Ray, like we're identifying some of those projects already. Because again, for somebody to spend the money by 2030 for major construction, those are mostly projects that have already they've already started some of their planning already. So, so we think we'll be able to do that. I will say another part of this I maybe didn't even talk about was about building really making sure we're getting clear on what the financing continuum is available to for starting up and expanding childcare programs, essentially, right? People sort of, right? The fact that people are still guessing around, we've got so many resources. It's like there are, but people don't know it, right? Maybe parts of state government don't know about the same things. They don't know about what local banks are doing. They don't know about what philanthropy is doing. So creating that coalition is something, and that space to make sure there is that shared awareness and shared and building sort of shared knowledge and referral networks is another thing that we're hoping to build during 2026 with some of the support from PDG. I know I talked a long time. It's very exciting.
It was all important context and information. I think people are excited and eager to hear all of it. But I imagine folks can follow up with Janet and other members of the team if there's any questions that we weren't able to address today. Any last words from, all right. Thanks, Flor. Great to see everybody. We hope everybody has a good winter break this week if you have some time off, and stay warm. Luckily, the weather's getting a little bit warmer, slowly but surely. Thanks for everybody's time today.